Hello everyone, welcome to the video on Target GPAT 2022 MCQ Series, and this is of a Pharmacology Question and Answer Explanation Part 2. In these videos I am going to explain all the previous GPAT questions related to pharmacology subjects with explanation. This is my YouTube channel. If you like the video content, do subscribe and share the video. Let's get into the class. Now, which of the following used in the treatment of rheumatoid arthritis is not a biologic response modifier? Let us understand the question. See, rheumatoid arthritis is a kind of autoimmune disorder. Now, in autoimmune disorder, what happens is our own human body immune system and inflammatory responses will be overreactive towards the body, and that is what results in autoimmune disorder. In this case, arthritic, the bone junctions will be attacked by immune mediators as well as inflammatory mediators that worsens the condition of rheumatoid arthritis. Now, to treat this, there is a major class known as DMARD. Let us understand about this. Disease modifying anti-rheumatoid arthritic drugs. DMARD means disease modifying anti-rheumatoid arthritis drugs. Now, disease modifying, the name it has got because they modify immune response as well as inflammatory response. What is the problem in rheumatoid arthritis? It is an autoimmune disorder wherein immune and inflammatory responses are overreactive, and that immune and inflammatory responses are modified by these drugs. Hence, it is known as disease modifying anti-rheumatoid drugs. Now, again, in this you have two classes are there. One is synthetic DMARDs, another one is biological DMARDs. As the name indicates, these are all synthetic drugs. Now, in this, one of the important one is leflunomide. So that is what is given here, leflunomide. Now look at the concept. So synthetic drugs, all of them are there, methotrexate, azathioprine, and all these things. Biological drugs, they are of biological origins like TNF alpha agonist, interleukin 1 antagonist, T cell modulating agents, B lymphocyte depleters. All of them biological agents. So these biological DMARDs, disease modifying anti-rheumatic drugs, are also known as biologic response modifiers. Now see, out of them, the question asks about which of the following is not a biologic response modifier. Anakinra. See, this anakinra is interleukin 1 antagonist. Etanercept, infliximab, all of them are biological response modifiers. Only exception is leflunomide. This is a synthetic DMARD. So this is a kind of concept oriented question, and you need to understand what does this DMARDs are and biological and synthetic DMARDs are. I hope this thing is clear now. Moving to the next one. Now, which of the following drugs have positive inotropic and a negative chronotropic effect? Now understand this. Positive inotropic effect means any agent which increases the force of contraction of heart. This is related to force of contraction of heart is known as positive inotropic effect. Whereas chronotropic, chronological events, or chrono means timely events. That means chrono is related to heart rate. Now, what is the question asked about? It is negative chronotropic. That means an agent which is increasing heart rate, an agent which is increasing force of contraction but decreasing heart rate. What is that agent is? See, all adrenergic agonists will have both positive inotropy as well as positive chronotropic action. Like dopamine, epinephrine, isoprendin, all of them has got both the actions. The only exception is here is digoxin. Digitalic glycosides has got a unique feature. They have positive inotropic effect. That means they increase force of heart contraction, but they have negative chronotropic. They reduce heart rate. What is the advantage of this? It is very advantage in case of congestive heart failure. In congestive heart failure, low cardiac output is there. So when people take this drug, what happens? Cardiac output is increased. But heart rate is reduced. What is the advantage of this? So reduced energy is required, a reduced oxygen demand is there when heart rate is reduced. So with lower energy requirement, cardiac output is increased. That is the reason why digoxin is a very good drug of choice to treat congestive heart failure. So the option is digoxin. Moving to the next one. Now, which of the following classes has been proved clinically as first line therapy for heart failure? See, first line therapy for heart failure. And next, and it has shown decreased hospitalization, improved symptoms, and delayed disease progression. All the advantages. For which class you have this? Now let us understand. See, the answer straight away is ACE inhibitors. Now, angiotensin converting enzyme inhibitors are doing this. Now, what is the action of this? ACE inhibitors will inhibit the release of angiotensin II. Now, what are the effects of angiotensin II? It causes blood vessel constriction. See, as the name says, angio means blood vessel, angiotensin, it creates tension, so it causes blood vessel constriction. Not only that, it increases sympathetic nervous system tone. Not only that, it also enhances aldosterone. Now look at all the effects. See, blood vessel constriction damages heart. Increased sympathetic nervous system, positive inotropic, chronotropic, damages heart. Aldosterone causes edema, increases heart wall pressures. All of them are very damaging, and all the three effects are neutralized by ACE inhibitors. So this is the first line to treat heart failure. Remember this? See, all the drugs can be used to treat heart failure. Cardiac glycosides, renin antagonists, nitrites, all of them can be used. But the first line, and with decreased hospitalization and delayed disease progression, is there with ACE inhibitors. The reason is the dangerous angiotensin II actions. Moving to the next one. Now, which of the following glucose transporter is a new drug target for the management of type 2 diabetes mellitus? See, the answer straight away is sodium glucose link transporter 2. Now, this particular transporter is present at nephron. Now, what is the job of this particular transporter in the nephron? It exchanges a sodium with glucose. So, it reabsorbs glucose into the body. So what happens is it is reabsorbing glucose into the body, and see, when glucose is reabsorbed into the body, let's say this is body and this is the lumen. So what happens is this transporter, whatever the glucose is going through the urine is reabsorbed by this transporter, and it exchanges as sodium, and sodium goes out of the body, and it is known as sodium glucose linked transporter. Now this increases the levels of glucose in body and may cause hyperglycemia. So by inhibiting this transporter, what happens? Glucose goes out of the body and hyperglycemia can be treated. So the option is option A. Gliflozins like canagliflozin, dapagliflozin are choice of drugs. Canagliflozin. These drugs will inhibit sodium glucose linked transporter 2 in the nephron. Now glucose transporter GLUT1, GLUT2, they are present in the cells and they are responsible for glucose delivery into the cell. Whereas SGLT1 is present in intestine. This is not the target. The new drug developed is to block this transporter at the nephron, and the option is A. Moving to the next one. Now, which of the following are critical neurotransmitters playing major role in depression? Now, there is a hypothesis called as biogenic amine hypothesis. Now, according to biogenic amine hypothesis, now depression is caused by deficiency of certain amine neurotransmitters like dopamine, norepinephrine and serotonin. So these are amine neurotransmitters, and decreased levels of these amino acids is what is causing depression, and that is what is given by biogenic amine hypothesis. So which neurotransmitters plays major role? Dopamine, norepinephrine and serotonin. Option B. Moving to the next one. Now, a 55-year-old man is under DOTS treatment for TB for last 4 months. Now, he has developed symptoms of peripheral neuritis. Which drug has to be used to manage peripheral neuritis? So, this is a kind of clinical oriented question. Now, in case of DOTS regimen, there are specific drugs are used, like isonicotinic acid is used, rifampicin is used, pyrazinamide is used, and ethambutol is used. So, this is the standard combination of DOTS. Now, there is a problem with isonicotinic acid hydrazine. This combines with pyridoxine, a vitamin, and it results in the formation of hydrazone. And this hydrazone goes out of the body. So, what is happening? Pyridoxine is combining with isoniazid, and it is converted to a hydrazone form, and it is going out of the body. So, it results in deficiency of pyridoxine, which causes peripheral neuritis. So, what has to be given? Pyridoxine has to be given. So the option B is correct. Moving to the next one. Now, which one of the following modes of HIV transmission carries highest relative risk of infection with a single exposure? Remember, with single exposure, highest risk. And this thing is there with transfusion of blood and blood products. All viral infections, even hepatitis also, the major route of transfecting is transfusion of blood and blood products. So that is the reason why disposable needles and syringes are used in many of the hospitals to avoid this one. Moving to the next one. Now, what is the primary mechanism of action of local anesthetics? Now, local anesthetics will cause loss of sensation. Now, loss of sensation is because of loss of depolarization. Now, neurons has got a property called as depolarization, and depolarization is what creates sensation. Depolarization is because of opening of sodium channels. So, local anesthetics, they will be blocking voltage-gated sodium channels. So, this is the answer. Moving to the next one. Which of the following anti-asthmatic drugs can cause convulsion as well as arrhythmia? Remember this, Theophylline. Theophylline is used to clear asthma, but the higher doses will result in convulsion as well as arrhythmia. So the option D is correct. Moving to the next one. Choose the correct combination of drugs that treat type 2 diabetes mellitus, which is weight neutral and without risk of hypoglycemia. Let us understand this. So you need to pick two drugs which will not affect weight and which do not cause hypoglycemia. Well, let us understand. To treat diabetes mellitus, you have two classes are there. The classes are known as insulin secretagogues. Insulin secretagogue means an agent which is enhancing the release of insulin. The other one is insulin sensitizer. Sensitizers will not increase the levels of insulin but makes the cells sensitive towards insulin. Now what happens with insulin secretagogues? Insulin is released. If insulin is released, what happens? All the glucose gets into the cells. When glucose levels in the blood is reduced, that causes hypoglycemia. So when blood has got less amount of glucose, it increases hungriness or appetite. When hungerness is increased, what happens? Weight gain occurs. So remember this concept. Insulin secretagogue has got weight gain as well as hypoglycemic condition. Whereas sensitizers, they sensitize cells towards insulin. So they will not cause weight gain and they do not cause hypoglycemia. So the question is about these drugs. You need to find out which are insulin sensitizers. See, glipizide, sulfonylurea and sitagliptin, incretin mimetics, both of them are insulin secretagogues. Whereas insulin sensitizers are metformin, bigonide and pioglitazone. So PQ. So option A is the answer. Moving to the next one. Now, which of the following classes of drugs cause side effects like dryness of mouth, tachycardia, urinary retention, constipation, blurred vision, drowsiness and impairment of cognition? See, all of them are opposite to cholinergic responses. Now, you need to understand what are cholinergic responses. There is a mnemonic is there, SLUTD. Salivation, so increases salivation. Lacrimation causes eye drops. Urination, digestion and defecation. All of them are cholinergic responses. So look at this, dryness of mouth. Why? Because salivation is not there. So this is anticholinergic action. Urinary retention. Why? Urination is not there. Constipation, digestion is not there. So all of them are responses of anticholinergic agents. So the option B is correct. Moving to the next one. Now, which of the following respective phase 1, phase 2 reactions are most common? See, phase 1, phase 2 reactions. The most common phase 1 reaction is oxidation. The most common phase 2 is glucuronidation. Now, we need to understand this. See, the reason for metabolism of drug is make them water soluble. Make them water soluble so as to they will be solubilized in urine and goes out of urinary excretion. Majority of drugs are excreted by urine route. So the job of metabolism is to make them water soluble. To make them water soluble, oxidation will attach as a polar group which increases water solubility. Glucuronidation, a big group is attached so that reabsorption from nephron is inhibited. They will not be reabsorbed, they goes out of the body. So this is the logic behind metabolism. The most common reactions are oxidation and glucuronidation. Moving to the next one. Which of the following is a beta-lactamase inhibitor? See, beta-lactamase inhibitor is clavulanic acid, sulbactam, tazobactam. So the job of these drugs are, they do not have very good antibiotic activity, very negligible antibiotic activity is there, but they go bind with the beta-lactamase enzyme and inhibit that enzyme. Hence they are known as beta-lactamase inhibitors. Moving to the next one. All of the following are indications for the use of ACE inhibitors except one. Identify that. Hypertension, yes. To treat hypertension, ACE inhibitors are used. Myocardial infarction, yes. ACE inhibitors are used. Left ventricular dysfunction, yes. They are used. Now the next one is pheochromocytoma, means adrenal gland tumors. Adrenal gland tumors are never treated with ACE inhibitors. Rather, they are treated with beta blockers and alpha blockers. Even beta blockers, alpha blockers will reduce the responses of high secretions of adrenaline. So that is the standard treatment. Or the tumor is surgically removed. So the option is this one. So ACE inhibitors are not used to treat pheochromocytoma. Moving to the next one. Neural tube defects may occur by which of the following anti-seizure drugs? See, all of them are anti-seizure drugs, but valproic acid will cause neural tube defect, especially spina bifida. Now understand this. The spine will be bifurcated into two spines. That is called as spina bifida. Even carbamazepine also shows the side effect, but here the option is valproic acid. Moving to the next one. Mifepristone gemiprost combination is used for medical termination of pregnancy. The action is caused by. Now see, this mifepristone is an anti-progestin, whereas gemiprost is a prostaglandin E receptor agonist. So the mechanism of action is this one. You have all the combinations are there, but you need to be clear with the mechanism of action. Mifepristone anti-progestin, whereas gemiprost is prostaglandin E receptor agonist. The next one. Now, which of the following are most important regulators in inflammation and are targets for anti-inflammatory agents in rheumatoid arthritis? The first question we have seen, they are known as biological response modifiers. They are tumor necrosis factor alpha and interleukin 1. So this is the choice. Now, which of the following drug produce significant relaxation of both veins and arterioles? Sodium nitroprusside has got this action. It acts on both veins and arterioles and causes vasodilation, significant vasodilation. Moving to the next one. An antiarrhythmic drug that inhibits potassium, sodium channel and calcium channels is. So this is Amiodarone. This is very notorious drug. It has got multiple side effects are there. In fact, the structure very much resembles to thyroid gland. So it has got thyroid kind of side effects are there and a lot of side effects because of this multiple channel activity. Remember this, specificity is important to avoid adverse effect. If a drug is very specific to one channel, the adverse effects are restricted or controlled. If it is non-specific, the adverse effects will be very wide. Why? Because it will be acting on multiple receptors and it can cause multiple adverse effects. Now in this case, Amiodarone is the drug of his choice, which inhibits potassium, sodium as well as calcium channels. Moving to the next one. Now P-Glycoprotein pump is responsible for which of the following? Now understand this, in our intestine you have enterocytes are there. The intestinal cells are known as enterocytes. Whatever the food or drugs which gets into the intestine, they will get absorbed into these enterocytes. Now these enterocytes has got this PGP pump. This is known as PGP pump, P-Glycoprotein pump. This acts as an efflux pump. Efflux pump means all these drugs which are getting to these enterocytes will be thrown back into intestinal lumen. Now this is dangerous because it causes drug resistance. Drug will be resistant because the drug is not getting inside the body. It is again going back to intestinal lumen. So how it is acting? It transports the drugs from enterocytes into the gut lumen, and that is what causes the resistance. So how this P-Glycoprotein pump acts? By sending, and that's why it is also known as an efflux pump. It sends out all the drugs from the enterocytes to gut lumen. So these are the set of 20 questions. All of them are previous GPAT questions. I hope you enjoyed the session. Thank you for watching this video. If you like the video, do subscribe.